The Board of Venture Technology meeting is convened at 9:04 a.m. on September 25th, 2025. This meeting is being held in person and through MS Teams video conference and is being recorded. The recording will be posted to the internet for public viewing. I will now call roll call. Todd Young, here. Chris Chapman.
Here.
Grant Smith.
Here.
Ron Ferris. Ron?
I was muted. Sorry. Here.
Perfect. Dr. Bruce Schwant?
Here.
Jennifer Ferguson?
She joined and then left, so I have a feeling she'll be back, but she's not in here currently.
Okay, so when she comes back on, do I need to recognize her or that she's present?
Yeah, I can
Josh?
say something. Yeah.
Okay, perfect. Members, when you wish to speak, please state your last name for the record. Board members are asked to not use the chat feature during meetings. The Health Licensing Office asks that individuals attending through MS Teams keep their phones muted and cameras off during the entire meeting or until they are given an opportunity to comment during the public and interested party feedback period, if indicated on the agenda. Public comment is limited to matters listed on the meeting agenda or topics relevant to what the board has statutory authority to regulate. Public members wishing to speak, please sign in on the roster sheet available in the room or email Josh Page at josh.page@oha.oregon.gov and provide your first and last name. Everyone is asked to to use appropriate language, manners, and protocols when conducting business. I'm going to go ahead and I have a couple of disclaimers I need to read. So I'm going to do that before we start. I wish to publicly declare for the record that I'm part owner of a college, the American Denturist College, that offers a denturist diploma and bachelor's degree in denturism, authorized by the Oregon Office for Degree Authorization. Although no one is required to attend my school, I may have the opportunity to financially benefit from persons who enroll in our college. I also wish to state for the record that I'm part owner of a testing services company, Universal Testing Services, that offers written and practical examinations that some states, including Oregon, have recognized as a tool for licensure. Although no one is required to take this examination, I may have the opportunity to financially benefit from persons who take our examinations. And with that, we are going to roll right into the agenda and start with, looks like items for board action.
Right. So this is Trampus Sheck at the Health Licensing Office. Looks like the first item up for board action is the approval of the agenda.
I get a motion to approve the agenda as presented.
Grant Smith, I make a motion.
Can I get a second, please?
This is Chris. I'll second that.
Any discussion? Okay, call the question. All those in favor? We're going to go through the roll call. Chris Chapman.
Aye.
Grant Smith.
Aye.
Ron Ferris.
Aye.
Dr. Schwant.
Aye.
Jen Ferguson is not yet added to the call. So motion carries. So moving on to the approval of the proposed 2026 meeting dates. You want to present those?
Yeah, so it looks like this is Trampus again, that we have the first meeting for 2026 is proposed to be for Thursday, March 12th, 2026 at 9 a.m. through Zoom. And then also the next meeting would be Thursday, September 24th, 2026 at 9 a.m. also through Zoom. And then they may, you know, if things come up, sometimes we have to schedule additional meetings or move things around, but
Okay.
we'd get on the books if.
We'll entertain a motion to approve the dates as presented unless there's members that will not be able to join us.
Yeah, this is Chris. I'll make that motion to approve those dates.
Grant Smith, second.
Perfect. All right. Any discussion? There being no discussion, we're going to call the question. All those in favor, starting with Chris Chapman,
Aye.
Grant Smith,
Aye.
Ron Ferris,
Aye.
Dr. Schwant,
Aye.
Jennifer Ferguson, not present. Okay, motion carries. Moving on to the approval of a new chairperson or chairperson for 2026.
Yeah, so this is the last meeting of the year, so a little business has to be taken care of. And so currently we've got Todd Young as the chairperson for the board for 2025, but the next meeting that we have will be in 2026. So this is the opportunity for the board to, we have a couple of options ahead of us. We could, somebody could, if everybody's happy with Todd continuing on and Todd is okay with continuing on, that's an option. If somebody else wants to do it, or if Todd doesn't want to do it, we can certainly have a discussion about somebody different stepping into that role. So keep in mind there are Todd, I got to look ahead a little bit to the next section of the board meeting that talks about board recruitment, but we have a couple of people that are technically not going to be around, for their full terms of 2026. Ronald Ferris is going to expire in 2026. So people can serve until replaced, of course, but we'd have to talk about that in a little bit later. But Christopher Chapman is also serving until replaced currently. Todd Young can reappoint.
I'm reappointing on Monday,
Yeah,
actually. I got
pending reappointment. Yeah.
pending reappointment.
And then Grant Smith looks like he'll be here most of next year. Bruce will be here all of next year, basically, and can reappoint. And Jennifer Ferguson is good until 2027. So our lineup is that's the picture of our lineup. But Todd is in a position where he will be here a full year, so he could continue on. Or if people want to talk about changing, that's fine.
I'll just put this out there. I'm happy to serve again in this role. However, if there's another board member that is wanting to, or if they want to see a change in leadership, or the board does, I'm fine to step away. I'm good either way. So whatever, serve at the pleasure of the board.
This is Grant Smith. I nominate Todd to continue on.
Yeah,
Thanks,
this is
Grant.
Bruce, I second that.
Thank you, Dr. Schwant. Appreciate it, Bruce.
All right. So unless there's any discussion, you can go ahead and take a roll call, Todd.
Okay. All those in favor, starting with Chris Chapman,
Aye.
Grant Smith,
Aye.
Ron Ferris,
Aye.
Dr. Schwant,
Aye.
and Jennifer Ferguson. I thought I heard a beat, but nope, not present. Okay, perfect. Thank you. Appreciate your trust. And yeah, okay. Moving on. Board member resources and membership information.
Yeah, so we talked about this a little bit during the chair discussion, but we have we have people in all of our positions currently, except for the vacant public member position. A couple of people have been serving until replaced. Christopher Chapman has been serving for quite a while until replaced, and Ronald Ferris, you're going to be coming up as your last. Well, yeah, you actually expire on 2/28/2026. I can't believe we're talking about 2026. Blows my mind. But yeah, 2026. It'll be at the end of your second term, and you won't be able to reappoint. However, you would be able to serve until replaced. So, and that is the same situation actually that Grant Smith is in, although technically you expired your second term 3 days ago. So you're actually technically at this point serving until replaced. And I just wanted to just touch base with both you, Ronald, actually all three of you, Ronald, Chris, and Grant, that you're okay serving until replaced.
Yep, I'm
Yeah,
cool with it.
yeah.
All right.
Right.
Ron, I'm
Yeah.
okay with it.
We
Yeah,
haven't had
Grant
a
Smith, I'm fine with it.
perfect. Yeah, we put out recruitment for new board members because that's what we're supposed to do. We got to continue on, but we just we haven't had a huge influx of applicants for it. So we do really appreciate the members that are serving as replaced that you're doing that. So that really helps us out and keeps us being able to conduct board business. So
This is Chrissy. I just wanted to say real fast, we have 0 applications on file for denturists. So if you would love to spread the word and if you have any groups of people that we could potentially recruit from, we would love that. So any information you can provide as far as recruitment efforts, I would really appreciate it. We have no applications.
Well, this is Grant Smith. I think at our spring association meeting, we might make a concerted effort to buttonhole a few people and talk to them about making an effort.
Great. Thank you.
Thanks, Chrissy.
all right. Well, so that takes care of all of that business. We can move on and start talking about licensing and other statistical kind of stuff. The first thing we're looking at, we're starting on page 17 of the board materials. So the first slide on page 17 talks about licenses issued. We're going through the different quarters, fiscal years, which of course run through July 1st through June 30th of the following year. So you got quarter 1, 2, 3, 4 of each one of those fiscal years. On here you can see these are the licenses issued. And then as you can see, the next one is licenses renewed. This is kind of showing a picture of how many of you are out there total every year. You can see there's about 112 that are renewed total per year. But kind of the other thing that you're seeing on this slide is how many people are renewing online versus how many are renewing by paper. Of course, it's easier for us to renew online. And it's easier for the licensees often to renew online, but there are some situations where people have to renew by paper, or just some people just choose to renew by paper. But you have pretty good ratios here, so that's good. So the next thing we see is licensees by age and gender. What you can see is, what this kind of gives us is a little bit of a picture of where the trends are. Are we replacing as many denturists as we're losing as they kind of age through the curve? And we are kind of a little bit on the right side of this curve. It'd be nice to get a little more people on the left side.
45% over the age of 58.
Yeah.
Travis, that's
so,
actually fairly concerning. I think it's
yeah.
very concerning, frankly. So,
yeah, because we are looking at a lot of people that are kind of moving toward that age of retirement, and so hopefully we'll be able to.
Trampus,
Yeah.
I just want to say for the record, Jennifer joined the call at 9:18.
Oh, perfect. All right, great.
Sorry.
great. Welcome, Jennifer.
Yes, sorry about that. My phone wouldn't connect.
All good. To catch you up, Jennifer, we're at the licenses by age and gender slide on the board, on the resources packet.
Okay.
Not sure what page that is, but 19, I think.
19.
So,
yep.
Yeah. Okay.
Yeah. So, I mean, if anybody wants to stop and discuss any of these slides, that's great. So here's your licensing trends. They remained pretty flat. Not really bumping up or down over the last several years. So they're pretty stable. So that's good. But
I'm excited to talk about the next slide, actually, Trampus.
oh yeah, so this is the Board of Denture Technology fiscal status. So as you can
What
see,
kind of excursions had the staff been going on to rack up $105,000 in expenditures in 2025? That's what I just got to ask.
yeah, I
I'm
think that
kidding.
well
That was
that came
supposed to be fixed.
that was supposed to be
Okay.
fixed. Do
Okay.
we
So
know what
that's
that
not a new.
actual number is, Sammy?
Did you catch that, Sammy?
Sammy, did you hear me? Did we get a corrected number for that?
You're on mute. If you're there, you go. She's on hold. What is that?
I think she accidentally took herself out.
I don't know
Oh,
what
there
I
she.
did.
There we go.
There she
It
is.
was supposed to be, we never actually got an updated one from Bob, so,
Oh, okay.
but
All right.
no, that is definitely incorrect. We
Okay.
noticed it and we're like, yeah, no, there's been no AG advice. There's been no major complaints, if any. So
I
yeah,
was just curious. Yeah, those are usually the things that would drive that number higher, right?
yeah, and we've had none
two.
of that.
Okay, awesome. So
what we can do is when Bob returns, I will get it sent out to the board.
perfect. Thank you,
If,
Sammy.
this is
Appreciate it.
Grant Smith. If I were a betting man, I would bet that there was an inadvertent zero in that number.
Yeah,
There was
I think you're probably
something
right.
wrong with, this is Josh, there was something wrong with the formula with the fiscal guy, and he fixed it, and everything stayed right around the same trend as it was.
Good
Yeah,
deal.
so it's probably close to removing that zero. That'd be in line with the rest of it. But
Okay.
we'll
Thank you.
we'll have to see when we finally get the updated numbers. Yeah. But as you can see, I mean, this board is pretty healthy. They've got a nice healthy balance, and they got a nice healthy balance between revenues and expenditures. You're actually in the black typically every year. Now, those kind of numbers can flip on us pretty quickly if we have something come up. It's not a huge, especially it's not a huge difference between revenues and expenditures. I know that one compliance case, speaking from being the regulatory manager, I know that one compliance case, a difficult compliance case can rack up be quite expensive, or a difficult situation where we have to involve, the AG or something pretty extensively. Those types of things can rack up very quickly, but you've got a nice healthy fiscal picture. So
Awesome. Thank you, guys. Appreciate it.
So the next item on here is the regulatory report. So so as far as we've got 3 bienniums still showing up on this report, the 2023 biennium, the 2025 biennium, the 2027 biennium, which we are currently in on this report. So you can see that in the 2023 biennium, we only had
Can I
7.
ask a quick question about that?
Yeah,
so
you bet. Mm-hmm.
When does the biennium close? Is it mid-year? Is it a mid-year close date? Okay,
yeah,
that's
so,
what I was trying to figure out how yeah, okay. It makes sense.
Yeah, so just for reference, the 2023 biennium ended on June 30th, 2023. The 2025 biennium ended on June 30th, 2025. And the 2027 biennium that we're currently in began on July 1st, 2025. So it's kind of a strange way to put it out there, but it gives you a sense of some history and what we've got going on as far as, how many complaints we're getting in, how many are remaining open. So the 2023 biennium, for example, we don't have any remaining open. We had 7 that came in, which, 7 in 2 years is really a pretty low number. And then 2025, we had a little bit more. We had 13 come in, and you can see that that year, particular year, we had 3 that were unlicensed. So that kind of bumped it up. We had you have a few complaints like that. And then the 2027 biennium, we've had 4 come in. Those are all still being investigated. I mean, they're pretty new cases. Sometimes cases do get closed out on like a screening process. So they come in, hey, I don't like my denturist, but it turns out that it's actually a complaint against their dentist or something, So sometimes those get closed, screened out. These were 4 cases that so far that have come in that are opened up that ended up getting assigned to an investigator. So
Great.
the complaints by type. So as you can see, we still have the 2023 biennium, which gives us 1 COVID complaint still on there. We had a special designation for COVID complaints because some boards got a really large bulk of them. They were related to not following emergency protocols during the COVID times. But as you can see, most of the cases of the 24 cases that we have in, most of them have some service complaint element to them. Even when there's a few that were unlicensed, they probably went along with licensed people, I believe. So there was a service component to it. There's one that was considered a licensing concern, which would have been either somebody working unlicensed or could have been somebody working with an inactive license, or it could even be other issues that come around a license. But I'm pretty sure that would have been one of the licensed people, would have just been a pure licensing concern. So, but you can kind of see, it gives you an idea of what's going on. Like I said, most of them are service provided complaints related to something that somebody wasn't happy with. Now, complainants by type, I'm sorry, this box actually does have an inaccuracy in it. I caught it looking at it. I thought that those numbers didn't look right to me because this board actually a fair amount, just anecdotally, I thought about it and I thought, gosh, a fair amount of people are actually, it's usually the client that's complaining, not necessarily some outside person. And I actually went through and I found that there was that for a period of time, things weren't being put in the system properly. So I went through and I hand looked at all of the 24 complaints that we had gotten over these last biennium that were on this report because I wanted a more accurate number because I didn't feel that this was accurate. And so I did find that we actually didn't have any that booked out as anonymous in the end. We had 13 that were from clients and then 11 from other sources. Now, sometimes that gets a little gray because whether you're a client or a representative of the client, sometimes they were personal services like my husband, my mom or dad, and sometimes those get marked as other rather than client, but they really are kind of more related to a client. You didn't have a lot of just out of left field, like I don't know this person, I'm filing a complaint against them, but a fair amount of them were actually clients. As this report, like I said, there was a problem with the data, not the report running. So, but I just kind of wanted to give you an update that it is more client based than this report was showing. So it should be better. You should see the better numbers on the next report. So does anybody want to talk about regulatory or the process? We didn't talk about processes or anything like that, but does anybody want to talk about this report or regulatory in general or anything like that before we move on? All right, then I will step back and let Sammy come in and talk about a discussion about emerging technologies, which is the next thing on our agenda.
Yeah, so this is Sammy Patnode for the record. And this got brought up at the last board meeting in the spring about the board discussing emerging technologies and how they fit in the denturist profession. And it was kind of left at that. And we didn't have any expanded information, so I didn't have anything to go on. So on Monday, we met with Todd, and he gave us a little more insight as to what he thought that what you guys were talking about. And it's kind of looking at the materials that are being used in these emerging technologies using resin rather than acrylic, and how those fit into the denture profession, making sure that it's in the school curriculum. And a lot of this is likely down the road, but something just to keep on our radar, to look at some rule changes, which we discussed, maybe putting some a little stricter rules in your practice standards, possibly looking at OHA doing a legislative fix on a couple things that could expand or broaden some of the terms in your law. And so that's kind of what we met about. We don't have really any major action items at this point, but it's for you guys to discuss, and that was my overview. If you want to discuss it, you can. If you don't, you don't have to.
Yeah, I kind of to kick this off, I was kind of leveraging on what Dr. Schwant had brought up about just protecting the public with some of the emerging materials in particular that are potentially in use in patients' mouths, and or how easily they can be modified or repaired, or altered if necessary in the case of like a reline type of a deal. So that also then pivoted to what were current best practices. There is a reference in our statute to FDA regulated equipment, but not materials. And so that's specifically what Sammy was talking about, potentially looking at modifying. Was that in the OAR, Sammy? I don't remember.
That was a rule.
No, that was a rule. Okay.
Yeah.
So, but I figured we could kick it off and discuss that. We talked about some the education piece for both Oregon-based, U.S.-based, and Canadian-based schools. What they're teaching when it comes to this, and talked about, I think that's kind of the general areas that we went forward on. So I know Grant had something to say about it, and then as soon as Grant's done, Ron, we'll have you speak. Go ahead, Grant.
Well, my question is about ADA approved materials and what role the ADA plays in this. I don't know if that's a satisfactory thing
It was
or a current
FDA.
thing, but
did I say ADA? If I did, I misspoke. I thought it was FDA approved.
Well, I'm talking about the ADA in this case.
Okay.
Because
Sure.
a lot of materials, the ADA does have a stringent, as far as I know. Dr. Schwant could talk about this probably better than I do, but there are materials that are ADA approved and those that are not.
Can you define what ADA is?
American Dental Association.
Okay, that's what I thought, but there is the American Disability, so I wasn't sure.
Sure, gotcha. So it seems to me, anything can be misused. I mean, cold cure acrylic can be misused. We see a lot of patients that come in who have nylon partials that they were never really told that they could break. We do have those sorts of problems, but we have also the variable in any practice to misapply or misuse things, whether attachments are put in dentures properly, or any material and any technique can be misused. And I just wonder how far we go with that, how deep in the weeds we go with particular things. There are some printed materials, if they're not handled right, they can be toxic. There are concerns on that level. But what I do think is that the ADA material approval is somewhat stringent. Anyway, that's my starting point there.
Any other input from board members? Go ahead, Ron.
Yeah, I think Grant, had a lot of discussion right there. I think quite a few times at the last meetings, it's been brought up by myself and others to have a committee and discuss this. So whatever the subject may be. So when I hear, Todd, you're saying, well, we we decided we talked about this. Who is we? Because I remember Dr. Shantz says, yeah, let's get a group together and talk about just like what Grant was bringing up. So I was curious who was in that discussion when it was said, well, we decided this and we decided that. Was
let me
that
be let me be clear. Nothing was decided. I'm going to go ahead and let Sammy speak to this, but it has to do with the requirements of establishing a standing committee. So, Sammy, go ahead.
Yeah, so basically at the last meeting, what was said is we want to talk about emerging technologies and we want to have a committee and we want to do all these things. But when you're dealing in government, we have to have a direction, right? Like, what is the committee? Is it a rules committee? Is it a legislative committee? What are the topics? So we met with, we actually emailed the dentist and we didn't get a response. So we met with Todd and said, can you expand on what you guys were talking about? Because I don't know. And I'm not going to call a whole public meeting and waste people's time and money to not have topics to discuss at a committee meeting, whatever that may be. So I want it to be clear, it was a business meeting for us to get some perspective on what exactly you guys meant by emerging technologies. It was a very broad statement, and that HLO is not going to do a committee unless we have some kind of focus on how we're going to try to move forward, whatever that may be, laws, statutes, qualifications, education, whatever that is. But none of that was discussed at the last meeting. So that's what we did. And it's now in the hands of the board to discuss. And that's what this is for you to discuss. And no decisions were made. No votes were taken. It's just a business meeting.
Okay, thank you.
Yeah, well, this is Dr. Schwant, and I just wanted to kind of chime in a bit about that whole idea, particularly about, okay, so there's the materials and there's the techniques and there's the way it gets marketed. And all of that, to me, seems to roll back around to the concept of, what are we training people to do, and what are the criteria we're training people on? That's, I think, the crux of it, because when the technology changes so quickly, you can't really put like some set standard in place, because next year there's going to be something that was completely unthought of when you wrote that standard. I guess what I would want to see happen, and the questions to be asked are, what should we be teaching the denturists? What level of expertise should they have about these materials in terms of their knowledge? Should a denturist know, for example, what the physical characteristics are of the material they're using? Do we already teach that? If we don't, it seems like a good idea. Is the denturist going to be making an appliance that will fit over a snap-on denture? Is that something that a denturist can make legally? Can a denturist also fabricate a fixed appliance, or is that now crossing into the realm of a DDS? I don't have those answers, but I think those are the questions I would like to discuss. And I think the only way to protect ourselves against advancing technology is having knowledge of the underlying criteria. And that's kind of where my head is at the moment on this.
Thank you, Doctor. I can speak to a couple things on that list. So, and I think Sammy can corroborate this. One of the things that I advocated for in the business meeting that we had was that we don't know what the landscape is going to look like a year, 2, 3, 5 years from now, as these technologies continue to emerge. And what is a problem today may not be a problem tomorrow. And so putting things into OARs or even statute doesn't seem like a great idea to paint ourselves into a corner, and maybe board policy statements relative to some of these emerging emerging technologies, at least until they solidify in the marketplace. As far as what's being taught to the students, I can only speak to what's being taught to the American Denturist College students. Those students are being taught in their dental materials courses. It's hard to keep up, I will tell you, in the dental materials courses. Just with the last 5 years, what's been going on, particularly with printing. As far as the reductive methodology, that's really the same. But there's a lot of new materials that are being printed now, including ceramics and all sorts of stuff. So metals as well. So to that end, you have what's being taught in school versus what's actually being presented in continuing education obviously we require that through our board every year. So I think that there's a whole ton of CE that's been presented over the last several years at association meetings, both state and nationally, to help keep current licensees up to date on what the materials are and the directions things are going. Go ahead, Sammy.
Yeah.
So the way that your rules are written and your law is it says that you have to learn about denture materials. And in this particular case, it's 5 credits. And then in your curriculum, it goes a little bit more in depth about that, which is identify the safe use of laboratory and clinical equipment, instruments, and materials used in denture construction, demonstrate methods of maintaining equipment and materials utilized in denture of removable dentures. So it's very vague. It doesn't say what type of materials. So it is able to change with the times.
Right.
That's the way I see this, but this is a document that can definitely be updated and expanded on.
Is that a policy statement or is that OER?
This is actually your curriculum. That is what we call it, or your objectives. Hold on, I gotta go to the name.
Are you talking about the American Denturist College or the?
It's called Denture Curriculum Objectives, Board of Denture Tech. It's very old.
Yeah, 1985.
Right, but it's what's referenced in your rules. So
Probably
this is what we use. But again, it is very vague as far as what you,
So those were published, those 1985 curriculum objectives or baseline competencies is what they were originally referred to as, were published by the International Federation of Denturists in 85. They updated them in 92, I think, or maybe it was 2003. And they're actually updating them again now. I've been serving on that committee for the last 2 years, working with a new. There are other third party. There are other learning outcomes that could be referenced that might be better than the IFDs. But if that's what we got right now, that's what we got right now.
Yeah, this is what's referenced in your rule. I mean, it can be updated and changed, and the way you have your credits laid out can be changed. You can add different course types. I mean, all that can be changed in the curriculum, and then the rule modified based on whatever that is.
That was one of the other things we talked about for the information to the rest of the board is the subject matter areas that are required for schools to teach to are very specific in the state of Oregon, insofar as they actually refer to credit hour minimums on those. It's the only state that actually references that. That's a problem right now, in particular, because, for instance, if you look at that list, anatomy and physiology has a tremendously high credit load compared to what other schools are teaching across Canada and the other US-based school in Bates. So I don't know that they would actually be able to meet those minimum standards to come into the state. That used to be a policy statement, and it along the way got swept into administrative rule. So we talked about maybe just leaving the subject matter areas, but removing the credit hour minimums to be able to provide a little more latitude. for licensees for access to care. So,
This is Grant Smith. I have a question.
fire away.
It's kind of it gets in the weeds a bit with regulation, because things are changing, and it seems to me like maybe guidelines or developing guidelines might be a better way to approach it. I could be very wrong, but if we were to develop some guidelines about material use and somebody has a complaint to the board, the guidelines would carry some weight with that. Whereas if we were trying to make rules and try to keep up with changing technology, that could be pretty difficult to do. And, there are crossovers where we intended to, cure a problem and we created another one. So.
Yeah, this is Dr. Schwann. I think what Grant was saying is kind of where my head is going also. So let me just kind of throw out some things from my own experience that I've seen in the past year. Patient comes in and they want to get all their teeth out, and so that's great. We're gonna make you a healing denture, and that healing denture is intended to last a year. It's made out of relatively cheap acrylic. It may be very thin. It's going to fit poorly, and the fit will get worse over the next 6 months, just so you know. Do we say that? Is that part of what we prep our patients for? And how long should, this is, I guess, getting around to something we could actually codify. How long do we recommend a temporary healing denture to everybody, or do we just let them go on their own knowledge base? Do we give them an expectation of how long a healing denture should last because it's cheap acrylic? Do we give them an expectation on how long a final denture should last because that's better acrylic? Those are, I think where my head is going with this is something along the lines of guidelines that we can give the denturists to give to their patients so that the patient knows what to expect. And another piece
I think the hard part for that is,
Ron
Dr.
has
Schwann,
a comment on that when you have a chance.
Yeah, I think I think the hard part on that is those are almost business practices that it's almost crossing into that, because, for instance, I know that for Medicare patients, they're allowed one denture, not a healing denture and a definitive prosthetic. And in the case of Medicaid patients, the ADA recommends a new denture every 5 to 7 years, but Medicaid only pays for a new one every 10. So it's a touchy situation. I think that there are some people that don't do immediate dentures, or that like you're talking about, or temporary denture. There's some people that are potentially using printed dentures in the immediate dentures, and up until recently there weren't options to temporary line those. So maybe some of the process they were using was to reimpress on the healing tissue and reprint those. And again, to your point, some of those materials could be suspect vis-a-vis how long they're supposed to be worn in the mouth. Is it up to a year? But we all know we have patients that don't necessarily follow the protocol on that, and now they've got a material in their mouth that is highly porous, and so we got Ron has a statement, and then it sounds like it looks like Sammy has her hand up. So go ahead, Ron.
No, thank you, Todd. You said that eloquently. It is a person's practice, whether they choose to do, okay, here's your temporary, here's a tube of glue, call me in 6 months and bring more money, or do you schedule them every 2 weeks, do your tissue therapy, I don't like temporary, I don't like permanent, I call it tissue therapy. So it's your practice, and it's difficult for some people. I don't do Medicaid just because I don't like being dictated and say, I can't reline that because the patient's not on the program anymore. So I'd have to eat that and reline it because I wouldn't leave them that way. And I'm not in network on most of the insurances because they dictate the price. And and my overhead doesn't meet that parameter, so I don't do network. So with the compliment to what you were both just saying there, I think practice standards has a lot to do with what it's not regulatory.
Well, I think it circles back to
Yeah.
informed consent. Really,
Yeah.
in that, I
Yes.
think maybe that's where you're going, Dr. Schwant, is, if you're not informing your patient, well, now we've got a practice standard violation. I mean, if you're not fully informing them of all of the options from, from A to Z, what they're, if you're not, I mean, even recommending implants, I mean, that's a practice standard at this point in time. You need to be educating your patients on the availability of implants, whether or not they can't afford it at this stage of their life. You still professionally have to do that. So I like the idea of having guidelines, back to what Grant was saying, or policy statements. I think we got to be careful to make sure that they're consistent with what current best practices are for everyone under the tent, so that we're not putting ourselves in a position where we end up as a board getting sued by Kaiser or Moda. I don't know. I mean, I don't know that it would go to that level, but Sammy, you had your hand up. It's down
Yeah,
now,
you
though.
could expand on your, you do have a definition of informed consent, so you could expand on that. Other programs have done that, midwives, body piercing. They expand on what they're required to provide the client, patient, whatever you're going to call it. They also have like client disclosure stuff. So on top of informed consent, here's what here's what we're required to disclose to you. So you can also do, and they don't have to be really specific. They can be broad, and you have flexibility to, depending on the patient, depending on the need, depending on what you can and can't do, it can be adjusted that way. So the rule's not so specific that you can't work around it, but you could expand on those types of things in a rule.
I like it.
Smith, I have something to add when I'm.
Okay, we got Grant, and then we'll have Chris.
So, to my mind, PARQ is not a formality. That's a thing we do. And I think, if you're not informing a patient, but you're writing that on your chart, that you've not done something. And, when we get into the idea of regulating, insurance companies also won't pay for temporary dentures. It's a case by case, it's a judgment thing. And I think beyond regulation, and every business is always in some way beyond regulation, there's good and bad business practice. And that just is something that, if we could totally eliminate bad business practices, we wouldn't need investigations and the things that have to happen through that route. So I think we all, when we are dealing with our patients daily, are thinking about our business practices and how every denture that we make, how is that going to come back to us in the future? And so I think my sentiment is that we not try to get too regulatory as we try to address these problems. I just think we end up in a mess.
Okay, Grant, and then who was after that? Who was it? Chris, yeah.
Yeah, I like the conversation here. I do think that guidelines would be more appropriate at this point. I like what you said, Todd, that going further than that at this point could put us in a box. But I do think that Dr. I'm sorry, what was the last name again?
Schwant.
Well, yes, sorry. I think Dr. Schwant does bring up a valid concern because, as a denturist and as in our profession, we certainly have got to be concerned about what's going on and all this new stuff that we're embracing, and it is moving very fast. I'm just wondering, is there any idea on how the dental associations are handling this concern? Because certainly it's not just the denturists that need to be concerned about this. Is there any pathway or protocol on how they're handling this? that we know of that we could look at.
I think Dr. Schwant would be the best to answer that currently.
Not that,
We created a new
yeah,
license for it, the dental lab licensing, which is directly related to the materials used in dental labs.
yeah. I don't know of any formal guidelines from the ADA regarding new technologies. Mainly, I think because it's so undefined right now.
Yeah.
This could go so many directions, and so they just leave it up to the individual doctor.
Yeah.
But I wish I could raise my hand. I can't seem to get on Teams, guys. I'm sorry about that. But what is it that maybe I should get more familiar with how the licensing exam, what is actually on the licensing exam, for what are the things that are looked at currently, and that might help give me some guidance on what might be permissible to issue as guidelines or as to suggest. So I guess another issue that I come across a lot is the idea, and this is totally off, maybe related, but maybe not, definitely not a materials thing, or kind of a materials thing, restorative space. How do we determine adequate restorative space for denture? Is that something we teach people? And is that something we test people on? Because that seems like a pretty important item. How do we determine centric relation versus centric occlusion? Do we teach people that, and do we test people on that? Because again, it seems like a pretty big deal to know. And if you don't have adequate restorative space, well, what do? You go back, do you refer the patient to an oral surgeon, or do you let them know that they don't have adequate restorative space, or maybe that their alveolar ridge is too large to be able to make a denture that doesn't look like horse teeth? Then there's my question about those little snap dentures. Are those removable or are those fixed? Because Zest right now provides a attachment that allows the practitioner with a little tool to snap that thing in so tight that the patient can't remove it, but the practitioner can remove it. Right. Is that a fixed appliance or is that a removable appliance? I think those are things that would probably make sense for a regulatory body to at least provide some definition, because otherwise you could easily get people kind of crossing over into this. Well, are you guys actually practicing dentistry, or should you even be doing that? Do you understand what happens if you create premature contacts on the second molars and the patient winds up with TMJ?
So let me speak. There's about 11 things that you've addressed here, Dr. Schwant. So
I think some of it, Todd, let me just say one thing really quick. I think some of it might be getting alongside the school and finding out what they're teaching, how they're teaching.
Yes, I would.
We lost you, Sammy. I lost you anyway.
I lost her too.
Okay. It says leaving.
I love what you said.
This is Josh. She's having to rejoin the meeting. She's having some technical difficulties.
Okay. So so there's a couple things to address, Dr. Schwant. So from a licensure standpoint, in the United States, the accepted licensure process has required a written and a practical examination, and in some states they have an additional basically a jurisprudence exam that's specific to that state, that where they test you on what the rules and regulations are specifically to that state. As I look at the Universal Testing Services written examination, there's 23 different competency areas that are tested, from general anatomy, orofacial anatomy, general histology, dental histology and embryology, periodontology, microbiology, infection control, pathophysiology, radiographic pattern recognition, dental psychology, dental kinesiology, gerontology, nutrition, pharmacology. Then you go through all of the different types of prosthetics, from theory and application, partial dentures, implant retained and supported overdentures, dental materials, ethics, practice management, and emergency care. So from that aspect, that is a mix of subject areas that the state of Oregon put together several years ago. That is being tested on, or your competency level, so that to make sure that you have at least a base level of competency to be able to begin practice. From a practical examination standpoint, candidates are required to take a patient from impression through try-in phase in one day. And yes, centric relation and centric occlusion are both tested, including working and balancing and tooth ridge crest relationship. Any of those areas, if any of those areas aren't met to based on the rubric presented, the candidate does not pass the examination.
Got it.
So as far as inner arch space and working with implants and that, it's absolutely taught at the American Denturist College, because that's part of what the baseline competencies are that the IFD required, that all schools that ascribe to that document have to teach. So it's without going full granular, there's about 7 different competency profiles throughout the world. And depending on what school or where the school's located, the schools or regulatory where a school is trying to educate those future practitioners, they'll have to meet those minimum standards. So in the US, there's at least 3 different ones that are referred to. All of them are mostly the same, but they're nuanced. Yeah. So I think that certainly, I think you and I are overdue for a lunch, probably a long one. So
well, you cover what you're explaining is answering a lot of my questions with regard to advancing technology, and having heard what you just said, that makes me want to go back and refine my own criteria for what might make sense, or if any kind of regulation is even needed, or if it's already in the license.
It might already be there, but again, it's one of those things like that the discussion always needs to be had, because our role here is to protect the public, and I think we all agree some of the stuff that I've seen come through. I need to be politically correct, and I'm not super politically correct. When people are chasing, or organizations are chasing profits, there's some material shortcuts that can be made that are a danger to the public. And I think you and I both know what we're talking about. I mean, and that I don't know that you're going to see denturists necessarily, but you absolutely could see denturists that are utilizing these materials, less techniques, but mostly materials. But it even could be the techniques that they're using for curing resins. Now, because if they're not, Grant was saying, if they're not cured properly, I mean, that's a serious danger. There's carcinogens present there. So it's and even material handling in the office. What are you doing with all that iso alcohol that you're using to wash and clean post curing? Where's that going? How the off gassing? Do you have adequate ventilation that you're turning over the air in that room to protect your? I mean, those are things that I don't know that actually rise to the level of regulatory, but certainly policy or best practices. They should be taught. They should be part of CE as these technologies are emerging. But I don't know. I mean, I'm not the best person to lead in that, because I'm kind of more smaller government less regulation because I can't see 4 steps ahead. So it's hard for me to discern that.
Yeah, I think a lunch would probably be a good idea.
Let's do it.
How do I contact you? You have my email.
I'll call.
Shoot me an email.
I'll do that. I'll do that, Bruce.
Yeah. That what you're saying explains a lot and refines my perspective quite a bit on kind of where the board has been in the past and how this question might be best addressed. So
yeah.
Thank you.
Yeah. Appreciate you bet. Further discussion. Okay.
I thought you did a great job, guys. I don't want to say I enjoyed that, but I respected it totally. Good job.
I'm not sure what it's going to take to get you to enjoy it, Ron, but it sounds good.
Well, Todd, it just brings back to many years of old school hard work that's already been accomplished that we're revisiting, and it's having to explain for it how successful that was. But thank you. You did it eloquently. Good. Okay.
I'll say this to wrap that up and probably move along. But thank you, Dr. Swamp, for being a part of this board and bringing your professionalism to this. And I think it's these kinds of discussions, open dialogue, and relationships that help both sides to understand that we're just trying to protect the public.
Yeah, I agree. And from my point of view, I'm like total neophyte in looking from a naive perspective on this. So I ask a lot of questions that may have already been answered. Sounds like a lot of them have. So that's good.
Well, it's always good to be able to because new perspectives bring. I mean it's important to revisit those things. So,
Yep. Good.
Is there a need at this point then to, or do we just? It's just that do we want to have another discussion point potentially at the next meeting on this to move forward? I don't see a clear direction to form a committee yet. This is the board. I'm at the board's disposal on this. What are the thoughts on that based on what Sammy's kind of outlining?
This is Ron. I agree with that. I don't see a specific issue that needs to be addressed. I think the openness and the communication has been established to my satisfaction. That's Ron. Just saying.
Yeah, and I from my point of view, this is Dr. Schwant. From my point of view, I think that getting caught up on a little bit more depth of what has already been done, and that can be done offline, would probably be extremely helpful for me. I do think there may be things that need to be addressed, because there always seems to be whenever technology changes, those unintended or unexpected events that nobody saw coming that seem to always, cause the biggest troubles. But I can't. At the moment, I can't put that into words accurately. So I need more info.
This is Grant Smith. The last thing that I would say is that when it crosses over, when we're talking about things that are not just poor workmanship or misuse of materials, but we're getting into danger, we get into some really dicey territory that we would probably need to consider, because science is such. Okay, you have a patient that comes to you, you made a printed denture, patient says they have a reaction. Did they have a reaction? Was it to that? It gets really, and best practices are something we should really emphasize. But when we get into the science of what causes a reaction or an illness with a person, we really get into deep territory. And so that's my only cautionary tale. And maybe just for that reason, maybe we should have a committee at some point that tries to really winnow out what is a danger to the public and what is a nuisance to the public as far as poor practices, and sort of at least address it from that point of view.
Does the board publish best practices?
There used to be policy statements. I don't know that there's necessarily, are the practice standards in a policy statement? Are they codified in OARs?
OARs.
OARs. Okay.
Got it. Okay, cool. I mean,
Yeah.
I'm happy.
Yeah.
I'm happy
Okay.
moving forward in this direction. I think it makes sense, Dr. Schwab. I don't know if it's committee time yet.
Can I ask a quick question of the staff? If Grant and Dr. Schwant and I got together for lunch, does that doesn't constitute a quorum, does it?
No. However, I would caution against it if you're going to talk about board business, because the new Oregon Government Ethics Commission statutes and laws and rules are very pointed on having
Well,
quorums.
what about Doctor and I having? I mean, is that because we're? I mean,
well, I mean, you're teaching him something, but if you guys are talking amongst yourselves and starting to deliberate, where's the deliberation line, right?
Oh, gotcha.
When are we deliberating? When are we not? You're just teaching him, this is how we do denture technology in the school or in your facility, or so. I mean, it's really, yeah, it's dicey. And
so we need to stay away from. Okay, I got you. I got you. All right. We'll make sure there's no cameras or video or recording equipment nearby. Okay, that was a joke for the record.
I know.
Okay. All right.
Okay. You have public comment now.
If there's no further, we're going to go into public comment at this time. The Board of Denture Technology will hear public and interested parties' feedback. Public comment is limited to matters listed on the meeting agenda or topics relevant to what this board has statutory authority to regulate. Comments will be limited to 3 minutes and will not be allowed if they are disruptive to the board's conduct of its business. If you're called on to comment, HLO staff will request the public member to unmute themselves. The chairperson and HLO reserve the right to end a person's comment early and have the HLL staff mute the public member if the comment does not pertain to matters listed on the meeting agenda or topics relevant to what the board has statutory authority to regulate. Are there any members of the public who wish to comment? If so, please raise your hand or use MS Teams raise hand feature and wait to be acknowledged. Were there any public members on this call?
I don't believe so.
Okay. All right. Seeing as there's no public members that want to speak, moving on to other board business. Is there any other board business? Okay, perfect.
This is Chris. I may have something. I reached out to Josh prior to the agenda finalization. I don't know if this got in on the agenda. If it didn't, we can do it next time. One of my concerns is obtaining a duplicate license through the licensing office. It seems like that's always a pain in the rear every year. There's no easy way to get a duplicate. Is there
because
any
it has to hang
in
because you have multiple offices and you got to hang it in the second office, right?
Yeah, that seems like when you are online, renewing online, there's no option to get that at that platform. And so you'll call into the staff via telephone, and then the staff doesn't know what you're talking about, and they'll direct you back to online. And so then I just give up. Just wondering if anything could be done there to make that easier.
Looks like Tina has a response to that. Go ahead, Tina.
Okay, this is Tina with licensing. You can't get a duplicate online when you renew your license. We have a form that you can fill out requesting a duplicate license. I'll have to check. I believe Adrian was on here regarding if there's a cost to that. But I do know that you guys can have duplicates. So
is that form available on the Oregon Board site?
Yeah, it's an information authorization form. Authorization information form.
Okay.
And you can do that. You can email Adrian and she can email you the form.
Oh, okay. All right.
Yeah, I don't see that.
And Adrian's email, can I find that on the online, or can you give that to me?
Yeah, I can give it to you real quick.
Sorry, I'm holding this whole thing up.
No, that's okay. I would say, you know, if there's a way, I don't see it under the forms portion of the Board of Dental Technology.
It's going to be under
webpage.
general forms.
Yeah, I just
So
looked.
here's Adrian's
I'm emailing
email
it to the board.
address.
Okay.
Are
Okay.
you ready?
Yes, ma'am.
It's ADRIANE .J.Perkins PERKINS at OHA.Oregon.gov.
Okay. Thank you very much.
And just email
And I
her
don't see-
and ask about the duplicates and she'll send you the form.
Okay. Sounds good. Appreciate your help.
You're welcome.
Okay. Any other board business? Fantastic. At this point, the Board of Denture Technology meeting is adjourned at 10:15 a.m. on 9/25/2025. Thank you, everyone. Appreciate all the input. We'll see you next year.
Thank you.
Thank you.
Thank you.
Thank you.
Goodbye, y'all.